Hampton Roads is one of 3 hotspots for colon cancer in America.
A study from the American Cancer Society determined that in 2015, and today the ACS's Cancer Action Network was in Norfolk to talk about ways to help people get better access to screenings and reduce deaths. And your side, Stephanie Hudson is here with some ways they are working on saving lives. Stephanie.
Tom and Lana, the ACS estimates that more than 3,600 Virginians will be diagnosed with colon cancer this year, and more than 1,300 will die from the preventable disease, they say. How do we reduce those numbers? Well, that was the topic at EVMS this morning, where medical and community leaders gathered to share ideas and inspire change.
Pamela Stevens is here today because of a colon cancer screening.
I was really scared to get that procedure done, and so I did wait probably a year or two, and then after that I was diagnosed. And how far Stage 4.
That was 18 years ago.
I had to go to my children and watch my children cry when I told them, and that's hard to do.
Today, Stevens attended this American Cancer Society forum focused on saving more people like her.
The disparities in our community still exist.
Dr. Bruce Waldholtz, a local gastroenterologist and ACS board member, says the reason Hampton Roads is a hot spot for colon cancer involves poverty and access to care. That includes things like insurance and transportation. The plan is to train community partners such as churches, barbershops, and the Urban League to become community health advocates.
We did this in Portsmouth about 15 years ago, and it worked.
That breast cancer campaign involved women talking to women about the importance of mammograms. Now it'll be colon cancer.
This will work, and in fact, we can sort of make it fun and talk about different football teams. We have a huge partnership with the National Football League. Get the men involved. What's your favorite team? Get a bunch of Green Bay Packers fans, Washington fans, Cowboys fans.
Stevens left inspired to spread the word and encourages others to join her.
Grab a hand, grab a friend, a family member, and say, hey, I got to do it for not just me, but for my children.
The medical experts also talked about the need to change laws and make FIT testing more available. FIT is an at-home alternative to colonoscopy. Medical experts say it can save lives and make it easier for those with barriers such as a lack or limited transportation and insurance. Stephanie Hudson, 10 on your side.